You can't just take a blanket approach to supervision of all ACPs because they all differ. They're all different, not just from a professional background, but also from how long they've been in their current role and what their background has been in from a career pathway, which has to all be thought about and utilised within your supervision. The other thing just to think about with them as well from that perspective is that they're all individuals as well. So they all have different learning needs, which you can't just take a blanket response to. You have to think about how you can do that differently based on the individual as well. So I think there's three main parts which sort of build up our supervision for our ACPs is what is their professional background, what is their previous experience and career pathway, and what are their individual needs as well. And that all has to be taken into account when we think about how our supervision will be set up for this group.
You need to be very nuanced around this. For example, I'm a physiotherapist, so with my physiotherapy background, I will see something through a physiotherapy lens. I won't see it through a podiatry lens or a dietetic lens. So being open and understanding and actually doing a bit of work to find out what goes on in those professions, you know, perhaps a little bit about their training and what their expectations are, will definitely help a clinical supervisor. And I think if you have worked in a multidisciplinary team, that probably is a bit of a strength for you as a clinical supervisor, because then you can already see the differences and you can also actually see the tensions.
For me, it's about incorporating some of those professional registration requirements into that professional that discussion around, okay, this is your current scope of practice, but actually thinking back to your professional registration, how do you weave that through all of those discussions that you have, even as an advanced clinical practitioner? So I don't see them as separate things. I think they need to be incorporated in the discussion. I think that's one of the reasons why people within my organisation will have clinical supervision as well as professional supervision, so that we're making sure that the requirements of their professional registration remain core to whatever they do, even though they have that extended scope of practice.
When I started in this, I discovered that having worked with nurses 25 years, I suddenly spent a lot of time talking to nurses in great depth, and I found that I hadn't actually understood that group of healthcare professionals think slightly differently to the way that I thought. And spending a lot of time talking to them, supervising them, working with them through their development has led me to have a much greater empathy for both that particular group of healthcare professionals, but also that opened up work with pharmacists and physiotherapists, and there's also a big difference in mindset between primary and secondary care, of course, and actually quite a different focus. So I think being very, very, very open, very transparent in communication, and very open to new ideas is absolutely crucial, and understanding that actually one profession doesn't have all the answers.
We've happily welcomed our paramedic colleagues into our team, but that has come with some of the learning curves, certainly for me coming from a nursing background. For instance, we had taken into account that paramedics may have never have done a urinalysis before. We just took that as something that everyone would know how to do. When we were asking them to work out of hours, they had no understanding of the hierarchy in the hospital. So some of the support mechanisms with the out of hours team, again, we had neglected to share all of that with them, just presuming that these people had experience of working within the hospital as we did as nurses. So it's important for you to reflect on where you're coming from.
We've certainly learned from some of our AHP colleagues, especially when we've had physiotherapists doing our prescribing, is that we've really had to focus more around prescribing with those groups of staff and about the administration of medication and being sensitive to the anxieties which comes around that. Nurses, we've found, struggle somewhat slightly more with uncertainty and that final decision making compared to what a physio would, or versus our paramedics, who are very good at making decisions but are also very pathway and protocol driven. So you need to think a little bit more about making them more wider in their thinking around decision making.
We have a physio who works within a frailty team in my hospital, and some of the things that possibly nurses would take for granted, that level of knowledge, to do with maybe catheters, bowel care, those sorts of things that are really important in a frailty environment, because actually constipation is something very, very important when you're dealing with older people, because it can have such a big effect on them. Actually recognising that that individual might not have that knowledge that they've brought with them through their training, but also acknowledging what they do bring to the team.
When we were looking at developing advanced clinical practice roles within St George's, it was really essential that we try to engage as many people from as many different professionals that we could, as well as management team and the senior nursing team. And we developed Advanced Clinical Practice Working Group, which we really made sure was absolutely multi-professional. So we have really good representation from nursing and physiotherapy, from dietetics, from radiology, from midwifery, from pharmacy. And it was only by engaging and making sure that we had good buy-in from all of the different professions across the trust, as well as making sure we'd had good management support and good buy-in from the senior members of the trust, that we're really able to move this forward and ensuring that we've got good supervision and support for those practitioners.